So local hospitals and hospital systems, including the Wilmington VA Medical Center, Nemours Alfred Agrippine Hospital for Children, and Christiana Care have joined forces with us here at the Blood Bank of Delmarva to increase blood donations. Temporary blood shortages are not uncommon during the summer and winter months, not to mention the holidays, but the pandemic has created a chronic shortage across the country that shows no sign of improving. The reality is particularly dangerous given the looming uncertainty surrounding the pandemic's trajectory over the course of the winter. We need 350 people a day to donate blood, and that treats patients ranging from trauma victims across the street, newborn babies, and their mothers, to cancer patients. Prior to the pandemic, you could stop by any number of community blood drives to give blood. And that has pretty much gone away. Our mobile operations are at just 43% of pre-pandemic levels. And that's significant because 40% of the blood we collect daily usually comes from a mobile blood drive that's conveniently held near you. At your place of business, where you work, or your neighborhood, or your church. And the big one is the schools, and namely high schools and colleges. You can start giving blood at the age of 17. And that is 25%. Just those blood drives alone account for 25% of the blood that we collect on a daily basis. Miraculously, we did have a blood drive last week at St. Mark's High School, I'm happy to say, but that's one out of, 35 high schools in the state of Delaware. So we're asking blood donors to make appointments at our 4 donor centers that are spaced out throughout Delmarva. Beginning in the south, Salisbury Donor Center, then go up to Dover Donor Center. You're here at the Christiana Donor Center, which is our headquarters. And we also have an outpost at the Christiana Care Concord Medical Center, just over the state border on US Route 202, otherwise known as Concord Pike. So, one of the things we've done, we've expanded hours here. The big one is adding Sunday hours every other weekend. This past Sunday, we were open here from noon at the, at the Christiana Donor Center right here, and also Dover. And we'll be back again on Sunday, November 22nd. That's been a big addition for us, just to encourage everyone to make appointments and keep them socially distant and spaced out. And this is all important because ideally we like to maintain a 7-day inventory of all blood types for hospitals, and that works for us. That's the magic number. We don't always get there, but if we get close to it, that's good. But imagine people were told they only had a 7-day supply of toilet paper. We all know how they would react. I still don't get that, by the way. I still don't get that. At any rate, I want to read for you now a quote from our Senior Executive Director of Recruitment and Marketing for the Blood Bank of Delmarva, Andrea Saparelli. And she's based at our parent company, New York Blood Center. The entire foundation of the way people donate blood has changed. The convenience factor of walking down the hallway while at work, getting out of class, or donating after religious services is gone. Instead, we have to rely on people taking an extra step of proactively seeking out a place to donate. So far, this isn't happening at the level we need. In normal times, announcing a blood emergency would create a short-term increase in blood donations, but this will not solve this particularly difficult shortage long-term. This is an incredibly challenging time for our communities. And it has been challenging, and I'll tell you how some of the things we get through it, or namely who helps us get through it. I'm just going to mention Riley Jadick real quick of Landenberg, Pennsylvania, 8-year-old little girl, battled leukemia. She took her last dose of oral chemotherapy in the middle of this past summer, and we rejoiced and celebrated with her. Emily Higgins is a 5-year-old from Wilmington. She battled lymphoma, and like Ryan, she received a number of blood and platelet products, and she took her last dose of oral chemotherapy, on June 27th. And we've all heard of little Maverick Painter. He was the premature baby that was barely 1 pound in weight. He received a total of 8 units of O-negative blood, and we just celebrated his 2nd birthday in early September.
And thank you everyone for coming out. It's so very important. So last summer, we had our annual Blood Bank of Delmarva Summer Challenge. And just to give you an idea of how this has really impacted, COVID has impacted our blood supply, last year we collected 300 pints of blood. I'm sorry, this year we only collected 300 pints of blood. Last year we collected 900 pints of blood from our hospital partners. So that's 600 units less this year than the previous year. The situation is even worse with our corporations. The Summer Blood Challenge in 2019, we had 4,000 corporate donors come out to give. This year, we only had 500. It's an incredible shortfall that we cannot make up. And Tony talked about our high school donors. 25% of our blood comes from high school and college donors. And the problem is, when we lose these donors in high school, we may never get them back. So it's not only a problem here in Delmarva, this is a problem that's national. If these young donors don't have their first experience when they're 17 in the comfort of their high schools, with their friends, with their teachers, with their faculty, they may never donate. So we're losing a whole generation of donors during this pandemic. And what's so important in this country is that there's something called the silver tsunami. And that's where about 50% of our blood supply is for people that are 50 years old or older, right? And so if we're not getting these young donors when they're in high school and when they're in college, we're in trouble. So we're asking people to help us to really turn this situation around. We are following all CDC guidelines at our blood drives, and we have been running blood drives safely, following all safety protocol. So anyone who can run a blood drive, we are asking you to do so. And for donor groups who've been shying away from running blood drives, please contact us, and we'll work out ways to work with you so we can run blood drives, collect blood safely, and impact all the people that are in the hospitals that are relying on those units of blood. Thank you.
Thank you, Tony. Good morning, everybody. Today we are appealing to the human side of the intent of our message and want to be as transparent as possible with our audience. EBD has been faced with several incidents since the start of the COVID pandemic that have resulted in the inability to fill hospital theaters due to injury, trauma, unexpected surgeries, and other medical-related events. EBD receives multiple phone calls daily from our hospitals in our service area requesting blood and blood products for these types of events. And one thing is consistent with our messaging. I do not have enough of inventory on the shelf to fill your entire order. More times than not, EBD's hospital services staff are faced with having these difficult conversations and trying to figure out if and when we can meet the needs of our customers. Our hospitals and patients we serve depend on us to have life-saving products available when the call to action is answered. UBD cannot be successful in our intent and our ability to service our hospital customers effectively and efficiently without your continued support and partnership. This is where you, the community, is needed to help EBD through the continuing struggle. Thank you.
Thank you, Megan. Now, most importantly, we'd like to turn our attention today to our hospital guest, our guest of honor. But before I introduce Dr. Butch Ujima from the Moores, I'd like to first read a statement from Dr. George Zanis. He's the Chief of Staff of the Wilmington VA Medical Center, a very important hospital in Greater Wilmington. As you can imagine, this is the week that we celebrate Veterans Day, and the VA could not be here today as a result, but Dr. Zanis did provide us with this statement, quote, "The COVID-19 pandemic has greatly impacted how and where people can give blood, and the need for blood donations is as critical as it has ever been. A sufficient blood supply at local healthcare facilities is vital in providing high-quality, life-saving care to patients. We implore all who are able to give blood to do so and save a life." Unquote.
Thank you, Tony. So again, I'm Butch Ujima. I'm the Chief Medical Officer and the Chairman of the Department of Anesthesia at the time. We all know that COVID-19 has impacted all of us in so many ways. I mean, it's changed the way we work. It's changed the way we play. It's changed the way we shop. For those of you with children, it's clearly changed the way our children get educated. But it's also it changed the way all of you get healthcare. Right? So for all of you that have been to hospitals or to a physician's office since the pandemic started, it doesn't look the same. It doesn't feel the same as it did before the pandemic started. You know, I've been in practice for 35 years. There are things that have happened this year I would have never imagined I would see in my lifetime. That you'd see hospitals across the country cancel elective surgery. You would see lines of people trying to get tested for COVID. You have patients getting tested for COVID before surgical procedure, before getting admitted to the hospital. And then you see patients in hospitals where they can't see visitors, or family members or loved ones can't be with them. I'd never imagined I would see that in my lifetime. But the truth is that hospitals still continue to provide care. And not only at my institution, but Christiana and all the Delmarva hospitals, we are doing our best to keep clinical operations open 24 hours a day, 7 days a week. And I'm here today with all the other people coming up to the podium today to try to highlight and educate and escalate to the public the dire need for blood. So I work at a children's hospital clearly, but we do things very similar to my adult counterparts at both Christiana and the rest of the state. We perform liver transplants, heart transplants, kidney transplants, bone marrow transplants, take care of patients with cancers. We perform thousands of operations every day, 7 days a week, 24 hours a day. We can't do any of this without blood. Blood is really the lifeline for many of these patients. And the blood bank at Delmarva in particular has really been our lifeline to these patients. We can't do what we want to do without everyone's help. And you've heard from the prior speakers today about the dire shortage of blood and blood transfusions in this country. So my plea to everybody today is contact your local blood bank facilities and donate blood. We can't do this without you. The Blood Bank of Delmarva has been an incredible partner with us in this endeavor. We've hosted blood drives in our hospital. We have several scheduled for 2021, but we need the public to go ahead and do this because we can't do this without your help. I think it's the only way we can continue to deliver care to not only the healthiest of patients we see, but the most fragile and the sickest patients that we see every day in our hospital walls. So again, my plea to you is pick up the phone, get on the internet, and schedule a blood donation. Thank you for your time today.
Good morning, everybody. Thank you, Tony, and thank you to the Blood Bank of Delmarva for giving me this opportunity to be here today, and also for serving our patients' needs at Christian Care and hospitals throughout the state of Delaware, as well as the Delaware region. I'm here to ask for the same thing that everyone else has asked for, and that is we need donors. I am the Associate Director of Trauma at Christian Care, and as you all know, and as you've heard throughout this presentation today, blood donations have reached a critically low level. So I'd like to underscore that when you donate blood, you certainly save a life. With every single, as a clinician, with every single unit that we transfuse, that unit saves a life. So it is a very satisfying thing to do. And as Tony said, I've been in 3 times since the pandemic. It's very safe, it's very streamlined. So I urge all of you who are able to and healthy and can get to a donation center to do so, because certainly lives in the Delaware area are dependent upon your community, your neighbors. We need this blood to take care of our trauma patients and also our critically ill patients, not only children, as previously described, but our adult patients, our cancer patients, our critically ill surgical patients, and our, like I said, from my own personal group, our trauma population. So again, thank you again for the opportunity to speak today, and we hope to see you guys all come down to the donation center.